My villagers, Ocugen just dropped a bombshell today that could change the game for blindness. 3 shots at FDA approval in 2025. Stick around to see what's cooking. I'm excited. With that aside, welcome back, villagers, to another episode of Hugh Tran the Insurance Man. It's your boy, back with some juicy news straight from Ocugen's playbook. Today, February 27, 2025, they're shouting from the rooftop about uno, dos, tres potential BLAs. Fancy FDA paperwork that could get their treatment greenlit. We're talking eye saving stuff, and it got me hyped. Let's unpack it together. This could be big for folks out there struggling to see. Hope's on the horizon, y'all. Hope's on the horizon. So, what's Oxygen even about? 3 BLAs, 3 big dreams. Let's get the lowdown. All right. If you're new to Ocugen Crew, they're a biotech squad out of Malvern, Pennsylvania, made in America. That's very important. All about fixing blindness with gene therapies and funky biologics. Today, we're flexing. They're flexing with 3 treatments: Ocu 400, Ocu 410, and Ocu 410 ST, each eyeballing a BLA, which is the golden ticket to sell in the USA. Or should I say, golden banana? That's just me. but, get back on topic, insurance man. These ain't just dreams. They're in hardcore clinical trials right now, and the FDA starting to nod along. Dr. Nina, thank you. Dr. Hama, thank you. And many other scientists, by the way. Aku 400 in phase 3 for retinitis pigmentosa, RP for short, a nasty disease messing with millions' sight. Aku 410 tackling dry age related macular degeneration. Also, phase 3. And today's star, Aku 410 ST, just got FDA alignment for phase 2 third trial for Stargardt disease. That's 3 heavy hitters, my villagers. 3 heavy hitters. Not those, not that, not uno, not dos, but tres. Sorry, my Spanish is pretty bad, but I'm trying. I'm trying. Just put this in perspective. Imagine a world where blindness gets a timeout. Could our village see that day? It's a beautiful day. Today's the day Aku 410 ST got its shine. FDA says go time. What's that mean for us? What's that mean for our company? Well, so the big news, the big drop today, Oxygen stoked because the FDA gave a thumbs up to kick off the phase 2 third pivotal trial for Aku 410 ST. That's for Stargardt, a rare eye condition hitting kids and teens, leaving them with blurry vision or worse. That just hurt me when I share that to my villagers. Imagine kids have blurry vision, a disadvantage, and worse is they're blind, they can't see. That's just unfortunate. They're testing 51 folks, 34 getting the juice, and after a year, they'll pitch their data for a BLA. If it works, it's a game changer. Ocugen said 1 year data is enough for the FDA filing, could be as early as 2026 if it goes smooth. And I don't like to sugarcoat things. I'm not a doctor. When it comes to data and it comes to FDA and BLA, they need to be sure data are correct. Don't bullshit anything because any error will leave backfire and you don't want that. So everything that the team are doing right now, I love because we've been working with FDA for a long time. And from what I observe, we have a team that understand what FDA want. So will this go smoothly? I don't know, but I am rooting for our team. That's just my 2 cents. I know I talk too much. Let's get back to topic, my villagers. They've got Aku 400 and Aku 410 aiming for BLA around the same time. So that's why I mentioned earlier 3 BLAs are lining up, 3 swings at FDA approval in one go. That's bold, my family. That's bold. And I like that. Bold with the BOLD. 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 What if all three hit? Or even, we're talking miracles or just hype? What if? Call me crazy, but I'm hyped. So now we really need to, let's meet the trio. Aku 400, Aku 410, Aku 410 ST. Three heroes, three fights. Here's the scoop. Check it. Aku 410, the OG, a gene therapy for RP, which screw your retina right here till you can't see straight. In phase three dosing patients, the oxygen bedding on 2026 BLA, you can find some of this information on our website as well too. But I'm sharing you what I know on top of my head. So if I stutter a little bit, I'm sorry. Then there's Aku 410, same phase three vibes, but for dry AMD. Think senior, your parents, 60 and above, losing their central vision. They can't drive anymore. Right here. What I'm looking at you right now, central vision. Not peripheral, but central. Yeah, I get emotional when I talk about these things simply because I work 8 years in the, I take care of vision for seniors and student and what Ocugen doing right now, I lived it. I personally seen patients like these and it sucks, man, because you have such a disadvantage to daily activities and it's not fair. That's why my heart is beating harder when I make this type of video because it I can see the vision. Let me continue. And now Aku 410 ST, the Stargardt Warrior, just got its FDA green light today. All three use this modifier gene tricks to fix what's broken in your eyes. Let me give you a fact to my villagers. RP affects like 1 in 4,000 people, small but brutal. Dry AMDs, a top blindness cause for the over 60 years old crowd, like your parents, your grandparents, whatever case may be. Stargardt rare. 1 in 10,000 but hits young children, your little nephews, your little nieces. Oxygen cash run lasts to, I believe, the end of quarter three, quarter four, 2025. So they're all in on these. And you can correct me in the comment section if you believe that is incorrect, but this is what I've observed and what I've learned and I read. That's why a lot of the short thesis they come and say, you're gonna run out of cash. Well, you do your own thinking. It's a free country. I'm gonna do me because I see the vision. Three diseases, three fixes. Could this crew pull off a hat trick? Kind of like hockey term. Could Oxygen and our team of top of the line scientists pull this off? We're gonna find out. We're going to find out. So, what's this mean for our village? Big wins or big weights? Let's wrap it up. All right, family, I'm getting too hyped because Oxygen got three irons in the fire. And if they land these BLAs by 2026, we're talking treatments hitting clinics. Could mean jobs, hopes, or just better days for folks we know, our children, our senior people we care for. They got cash till mid third quarter, end of 2025. It's really hustle time. It's time to grind. It's time to make sure that the world know this is made in America. Oxygen is made in America. I don't want to get into politics, but sometimes we have to understand politics in order for us to make an educated investment. But that's just me. You do you. Today's news says they're serious. FDA's on board, trials are rolling, but I'm not a doctor. I won't sugarcoat it. It's biotech. Risk as heck, right? A brother of mine told me, and you guys probably know him, Urban, high risk, high reward. And I believe that, but I did not invest in our company out of nowhere. We spent a lot of time, a lot of research, and things are aligning up. Science first, made in America. Once Elon and Doge do their part of cutting down waste, unnecessary stuff, because they're sending money all around bullshit. I'm sorry if you have children watching. I didn't mean to curse, but Elon is doing something that no one have done before, and that is cut wasteful spending. Once that is done and sorted out, I strongly believe, and this is my humble opinion, not financial advice, Ocugen will get a piece of that extra cash floating around for nothing because we are made in America. We are a company that is going to help people see again, senior, children, and in between. That's powerful. Remember, my villagers, made in America. I will repeat that over and over until you understand what that really mean. What that really mean. Made in America. I'm rooting for our company. We're a village that bets on the underdog, and Oxygen's swinging big, baby, like Mike Tyson. Pop, pop. If they nail it, we'll be telling stories about how we saw it coming. And the short thesis, they hate it. Oh, pump. You got pump. All you do is pump. But uno, dos, tres. BLAs. Powerful. What do y'all think, my villagers? What do you make of it? Should we cheer or chill? Let me know in the comment section. But like always, before I let you go, take care of your family. And most importantly, take care of your health. Until next time. Let's go, baby.